Dr. Anthony Fauci is the country's top infectious disease doctor. He's the head of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. As you know by now, he's a member of the White House Coronavirus Task Force. Dr. Fauci, thank you so much for joining us. I know you got a lot going on, but I want to start with the story Manuel just did about the passengers on the ship. On one hand, you have passengers who are sick, who need attention right away. On the other, you have so many who are not sick, who are very frightened. What are your thoughts? Should they be let off the boat?
Oh, absolutely. There are a couple of things that need to be done, and we have experience, remember, with the Diamond Princess in Japan a short while ago. First of all, you have to take care of the people who are ill. You just have an obligation to do that. And as quickly as possible, you've got to get the people who are not sick, who are not infected, off the ship. Now, remember, there are both Americans and people from other countries. So we've got to get the Americans off, and we've got to get the people from the other countries safely back to their own country in cooperation with the responsible country. But this is absolutely necessary to do before you get further spread of the infection.
It does seem to be a humanitarian issue. And I want to say to the audience, there's a slight delay with Dr. Fauci, but we can hear each other. So bear with us. Dr. Fauci, we all know this is a pandemic of numbers. And I heard you say the other day, the now projections are up to 240,000 people could die. And this is practicing the social distancing. I also heard you say we should not be discouraged. I was encouraged to hear that. But why should we not be discouraged when we hear such frightening numbers?
Because it's within our power to modify those numbers. Those numbers that you heard the other day that Dr. Birx and I mentioned from the White House press conference were numbers based on a model. You model what the projection might be. And the projection was that even with considerable mitigation, you still could anticipate between 100,000 and 200,000 deaths. However, if you really push hard on mitigation and data comes in that tells you you're doing better than the model, you can modify the model. So what I was saying is that even though we need to anticipate these rather disturbing numbers, we shouldn't give up and accept it and say, okay, that's going to happen. We need to push and push with the mitigation to try and get that number lower than the projected number by the model.
So it doesn't have to be inevitable is what you're saying. You know, the CDC says 25% of the people don't get symptoms of coronavirus. So how will we know when it's safe to lift the restrictions?
Well, there are a couple of parameters that you look at. One is you look at the curve of the new infections, of the people who get hospitalized and the deaths. Those graphs that we have been showing at the White House, the one that peaks and then starts coming down. But also we're going to be instituting tests that can actually show how many people in the population have been infected. So in addition, right now we're focusing on those who have symptoms, getting them identified, isolated, trying to get contact tracing, doing physical separation. But what we would like to do reasonably soon is to get a better feel for the totality of the infection in the community, even those who've recovered. And you could do that by a relatively simple antibody test. That's one of the things that we're aiming for as soon as possible.
President Trump says he's considering banning domestic travel. Is that your advice to him?
No, we look at that literally every day. It really depends on what city you're talking about and from where you are coming. So this is something that you're absolutely correct is on the table and it's discussed, but no decisions have been made about banning travel within the domestic United States.
Dr. Fauci, I know we have to go, but there are reports that you now have to have security. I was very sorry to hear that for you. And I'm wondering the personal pressure. Do you feel pressure to get this right? You know, you are the most respected, the most admired. When you speak, we listen. I'm wondering how this has affected you personally.
You know, it's my job. This is the life I've chosen, and I'm doing it. I mean, obviously, there's a lot of pressure. I mean, I would be foolish to deny that, but that's what I do. I've been through crises like this before, dating back, 37 years from the very beginning of the HIV epidemic. It's a job to do, and we've just got to do it.
Well, Dr. Fauci, listen, you're on donuts, you're on socks, you're on mugs. There's Fauci Friday. People magazine, there's a petition to make you sexiest man alive because people say brains are sexy. So we are all paying attention to what you're saying. I'm wondering how what your family thinks about all of this.
It's really kind of crazy. We try not to pay attention to that and just focus on the responsibility and the job that we have. That's the most important thing, not that other stuff.
It is the most important thing, and we are all cheering you on. Thank you, Dr. Fauci.
Good to be with you. Thank you.